This medication, Momelotinib 200 mg tablet, is used to treat myelofibrosis, a type of cancer that causes anemia, low red blood cell count. It belongs to a class of drugs known as kinase inhibitors, which work by blocking the body from producing substances called growth factors. These growth factors cause cells to grow and divide, leading to the blood cell and spleen problems found in myelofibrosis. While not a cure for this condition, Momelotinib may help with symptoms such as abdominal discomfort, pain under left ribs, early feelings of fullness from meals, night sweats, itching, and bone/muscle pain. The daily dosage and optimal timing for taking Momelotinib 200 mg tablet should be determined by a healthcare professional. Be sure to discuss any concerns or questions about this medication with your doctor. Before you start taking Momelotinib, make sure to read the patient information leaflet from your pharmacist. Take this medication by mouth as directed by your doctor, usually once daily with or without food. Swallow the tablets whole, and do not crush or chew them. The dosage is based on your medical condition and response to treatment. To get the most benefit from this medication, use it regularly and try to take it at the same time each day to help you remember. Do not increase your dose or use this drug more often or for longer than prescribed, as it will not improve your condition any faster and may increase your risk of side effects. Possible side effects of Momelotinib 200 mg tablet may include dizziness, diarrhea, nausea, vomiting, stomach pain, or tiredness. If any of these effects last or get worse, it's important to tell your doctor or pharmacist promptly. It's also important to be aware that this medication may lower your ability to fight infections, making you more likely to get a serious infection or make any infection you have worse. If you notice signs of infection, such as a sore throat that doesn't go away, fever, chills, or cough, it's important to tell your doctor right away. Additionally, this medication may have serious side effects, including liver problems, easy bruising/bleeding, heart problems, blood clots, and cancer. It's important to discuss any history of heart disease, stroke, cancer, or risk factors for heart disease with your doctor before starting this medication. If you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing, it's important to seek medical help right away. It's essential to remember that this is not a complete list of possible side effects, so if you notice any other effects, it's important to contact your doctor or pharmacist. And if you have any concerns about the medication, you should discuss them with your doctor. Before taking Momelotinib, it's important to let your doctor or pharmacist know if you have any allergies or if you are allergic to this medication. This is because Momelotinib may contain inactive ingredients that can cause allergic reactions or other problems. Before using this medication, be sure to inform your doctor or pharmacist about your medical history, especially if you have any liver disease or current/past infections. It's important to note that Momelotinib may make you feel dizzy, and using alcohol or marijuana can increase this dizziness. It's best to avoid driving, using machinery, or engaging in activities that require alertness until you can do so safely. It's also recommended to limit alcoholic beverages and talk to your doctor if you are using marijuana. Momelotinib can also make you more susceptible to infections or worsen current infections. It's important to stay away from anyone who has an infection that may easily spread, such as chickenpox, COVID-19, measles, or the flu. If you have been exposed to an infection, it's important to talk to your doctor for more details. Before receiving any immunizations or vaccinations, be sure to inform your healthcare professional that you are using Momelotinib. It's also important to avoid contact with people who have recently received live vaccines, such as the flu vaccine inhaled through the nose. To reduce the risk of getting cut, bruised, or injured, it's important to use caution with sharp objects like razors and nail cutters, and to avoid activities such as contact sports. Before undergoing surgery, be sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or planning to become pregnant, it's important to let your doctor know. You should not become pregnant while using Momelotinib, as it may harm an unborn baby. It's important to ask about reliable forms of birth control while using this medication and for 1 week after the last dose. If you do become pregnant, be sure to talk to your doctor right away about the risks and benefits of this medication. It is not known if this medication passes into breast milk. Due to the potential risk to the infant, it is not recommended to breastfeed while using this drug and for 1 week after the last dose. It's important to consult your doctor before breastfeeding. It's important to be aware that Momelotinib 200 mg tablet may interact with other medications, which could impact how well the drugs work or increase the risk of experiencing serious side effects. It's crucial to keep a record of all the products you use, including prescription and over-the-counter medications, as well as herbal products, and share this information with your doctor and pharmacist. It's essential to consult with your doctor before starting, stopping, or changing the dosage of any medicines. If you or someone else has taken too much Momelotinib 200 mg tablet and are experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call the local Poison Control Center at 1-800-222-1222, and in Canada, you can reach out to a provincial poison control center. It's important to seek help right away in case of an overdose. Remember, it's important not to share this medication with others. Before starting this medication and while you are taking it, you may need to have lab and/or medical tests, such as complete blood counts and liver function tests. Make sure to keep all your medical and lab appointments and consult your doctor for more details. If you happen to forget to take a dose, just skip it and take the next one at your usual time. Don't take 2 doses at once to make up for the missed one. When it comes to storing Momelotinib 200 mg tablet, it's important to keep it in its original container, tightly closed, and at room temperature. Make sure to store it away from light and moisture, and keep the desiccant, drying agent, in the container to protect it from moisture. It's best to avoid storing it in the bathroom, and as always, keep all medications out of reach of children and pets. When it comes to disposing of Momelotinib 200 mg tablet, it's important not to flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, make sure to properly discard the product and it is expired or no longer needed. If you're unsure of how to do so, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.